How can we make a big bet for better nutrition? One answer: food is medicine. A staggering number of veterans are living with diet-related diseases and food insecurity. But a bold idea connecting healthcare to fresh food is making a difference. It's a mission that has the Veteran Health Administration working with community partners. Together, they're giving doctors and nurses new tools to help their patients. In North Carolina, Reinvestment Partners is one group making that vision real, partnering with the VA on a produce prescription program, putting $100 a month worth of fruits and vegetables into the hands of veterans. This isn't just about food. It's about making support simple, about honoring the full humanity of those who've served. Let's see what a big bet for better health and nutrition looks like.
Peter Skillern, CEO of Reinvestment Partners, and Connor Drake. Connor, who is an assistant professor in population health sciences at Duke University School of Medicine and also health scientist at the Durham Veterans Affairs healthcare system. He does a lot of things, but we're going to start with you, Peter.
Okay.
Let's talk about the veterans.
All right.
Let's hear about them. Who are they? What's going on in their lives? Why are they the population that you're focused on?
Well, we're an anti-poverty organization based in Durham, North Carolina. We feed the homeless and house the homeless and feed the hungry. And we have a community garden and a food hub and a healthy corner store. While that builds a better community, it's not necessarily helping individuals with their health. And so we started a produce prescription program. We're providing a benefit on a restricted debit card so people can buy WIC-approved fruits and vegetables at any retailer in their community. When Rockefeller first funded us, we were serving 1,000 people at our local clinic in Durham. Today, we've served 150,000 people in the program. And that's both across North Carolina and in California. We've developed a program that debit card is now available, can be used in commercial retailers across the country. We have built APIs, technology to interface with the healthcare system. So we now have partnerships with Centene and Blue Cross Blue Shield as insurers. Hospital systems like Duke and Novant and Atrium and UNC Chapel Hill and the Durham VA. Those partnerships then allow us to continue to expand and do research. We have 16 evaluations looking at the health outcomes and the economic impacts of the produce prescription program. While this is a local program, it really has national ambitions because we believe it can integrate to the whole system. The Durham VA is key to that. So we spent $2 million serving 3,000 veterans with the produce prescription program, and Connor helped to lead the evaluation of those outcomes. But I think I don't want to lose in those big numbers and achievements the impact on the individuals, their needs, and what it means to them. So I've interviewed two folks. I want to read their quotes. They're from Pamlico County, population 12,342. A little different than New York City. Ernest Purcell, he's 71. He's born and raised in Pamlico County and served in Korea. Quote, there are a lot of veterans that can't afford to eat well, and free vegetables would take a load off their budget. They have programs out there like the food bank, but a lot of veterans aren't going to go. They won't. They're pride. But I'll take whatever help they will give me because really they owe that to them. They really do. Because these guys are like myself. We put our life on the line every day. Lenny Lott, 54, served in Desert Shield and Desert Storm. It did a lot of things. It enabled not only myself, but my family to eat more nutritious food that we couldn't afford at the time. So it not only helped me out because I'm diabetic, it also helped them to eat well. Whereas a snack used to be potato chips and all that, it became apples and oranges. So everyone was healthier. There are thousands of veterans, just like Lenny and Ernest, who serve the country and find themselves both food insecure with diet-related disease. So working with the Rockefeller Foundation, the VA, and our research partner, Connor Drake, we're committing $1.3 million to be able to serve another 1,500 clients in a randomized clinical trial to see what those health outcomes are as part of a big bet that we can convince the Veterans Administration to adopt food as medicine.
Connor, from your perspective, what is the systemic challenge here? Why is there so much food insecurity? What is going on?
Yeah, thank you, Manoush. It's a pleasure to be here. Appreciate the opportunity. And you're right, it is a systemic challenge at play here. It's complex, it's multifactorial, it's deeply ingrained into our society. Just to give a sense of the prevalence here, among U.S. households over a 12-month period, about 1 in 8 households will experience food insecurity over a 12-month period. For veteran population, that number jumps up to 1 in 4. So I think many in the audience understand intuitively what food insecurity means, why it's such a threat to health. It incentivizes eating a high calorie, low quality, and low cost diet. But it also operates through other pathways. One is called a compensatory pathway. So essentially, a veteran is forced to make trade offs and hard decisions around their monthly budget, where affording healthy food comes at the expense of affording medications that they've been prescribed and need to be adherent to. It comes at the expense of housing to stay in a safe and stable housing situations. It comes at the expense of being able to access healthcare and medical appointments and transportation barriers. We're also seeing an independent association between food insecurity and psychological well-being. So in other words, food insecurity is associated with higher levels of depression burden. It's also associated with lower self-efficacy and self-esteem. It's also a major association with suicide ideation amongst veterans. It's a very serious health risk. It's a very complex challenge, and it's made even more complex by the fact that a veteran population isn't just disproportionately experiencing food insecurity. The veterans are disproportionately burdened by diet-sensitive chronic conditions. So, in other words, diabetes, hypertension, congestive heart failure. Food insecurity exacerbates this. It's a toxic combination. And it's not just a toxic combination when we talk about mortality and health outcomes and some of these, for example, diabetes-related comorbidities. It's also driving escalated medical intervention in terms of hospitalizations and emergency department visits. So it's really going to require a real paradigm shift. And I think that's what we're talking about with the research agenda we're moving forward in the VA.
Yeah, so tell us more about what you're seeing that is shifting as a consequence of the program.
Yeah, so I think if we zoom out, what we're trying to do here is reimagine the role of a healthcare system. That sounds huge.
It's big.
Sounds huge, but we really do have to think about a new paradigm that moves away from a disease-oriented, reactionary approach, right, towards a system that's proactive, is participatory, and importantly, it's personalized and it's responsive to these intersecting medical needs like diabetes or hypertension or heart failure and social needs like food insecurity. So I think there's a breakthrough moment here right now. There's a shift towards understanding that food is more than sustenance. It is a medical intervention. And the VA has founded the Food Security Office in 2022. So that's a national office. There's a ton of momentum behind it. And I think the VA, I'm biased as a VA researcher, but I think the VA has launched one of the most ambitious food as medicine translational research agendas in the world. So there are large-scale research studies happening in the VA here in New York, in Syracuse, New York, in Maryland, Salt Lake City, Houston, and including our trial in North Carolina where our team is testing the Eat Well Produce Prescription Program at the Durham VA. We're the largest trial. I'd like to point out we're going to be a 1,500 veteran households participates in a very large randomized clinical trial. And as Peter had pointed out, it involves removing cost barriers entirely for healthy eating related to preserving choice, for choosing fresh, frozen, canned produce items, vegetables, beans, fruits. We're not just going to look at health outcomes and healthcare utilization, because we know, of course, providers and payers care about that, but we're looking at outcomes that matter to veterans. In other words, patient-reported outcomes. How does this affect psychological well-being, quality of life, care satisfaction with the care they're receiving in the VA is going to be one of the largest studies of its kind. And, the big bet here, I think, is that the VA plays a very unique role in healthcare delivery reform in the United States. It's the largest integrated health system in the country. And as Raj pointed out, let's just put this into perspective. It's both a payer and a care delivery system that serves 10 million people. That's the national healthcare system of Sweden. Okay, just to put it into perspective, the size of the VA. And there have been many innovations, medical innovations that, and I'm talking about mental health integration in primary care, telehealth, oncology telehealth, tobacco cessation programs, many medical innovations where they initially were scaled within the VA to determine best practices before being scaled outside the VA for the rest of the American healthcare system. So in other words, we're really making a big bet that the VA, we can build the evidence base within the VA to serve as a bellwether for national change in the way that we integrate food as medicine as part of routine care delivery. And I think that's a really big deal. And what makes it special is this collaboration we're building. We have a team of researchers, our team, among other researchers around the country. We have Reinvestment partners, deep expertise around these programs and bringing community perspectives. We have leadership within the VA on board, facility level leadership, and Rockefeller Foundation has really been a model for forging the right type of partnerships here and creating these really, I think, highly leveraged opportunities.
So, Peter, let's give you the last word briefly. Tell us, we've got the clinical side, we've got the data, you're on the ground. What can people learn from how this is all coming together?
I do think Rockefeller is a good model for how to build not just a project, but a movement. There are partnerships from across the country. The way I just got done with the program meeting, and the program officers really listen. They thank me for what I bring to the table, much like I thank them for their contribution. It's time, talents, and treasure that Rockefeller's bringing. There's a huge, ambitious goal here. The vision isn't just the veterans. I mean, if we helped hundreds of thousands of veterans, it would be awesome. A model for the health sector, awesome. But the next sector up is to change Medicaid and Medicare and the commercial lines of insurance, like for employers and individuals. That's a big shift. You thought it was big that a nonprofit was successful or a research initiative was good. Change the veteran? No, they're going to change it all. And it's a cultural change. It's a political change. It's a technology change, right? It's a shift in how we perceive healthcare and how we're going to take care of our veterans and our country. Part of this is we really are emphasizing our values in this, why we're doing it. Let me tell you what, this is also a financial argument. It's a return on investment. I don't know that our healthcare system can continue to sustain the spending that we're doing unless we find ways of lowering the cost of healthcare by reducing chronic diseases by improving health. This is the way we're doing it.
Peter Skillern and Connor Drake from Food is Medicine, thank you both so much. Thank you.